Welcome to NAATI for All YouTube channel. Here, you can practice sample dialogues for NAATI CCL exam. The following is a dialogue between a doctor and a patient who has just been diagnosed with diabetes. The doctor explains some of the symptoms and gives some details about what the patient needs to do to manage the disease and to control sugar levels. The dialogue begins now. Good afternoon. I'm glad you could come today. I asked you to come in so that I can give you some information about diabetes, and how to manage it.
非常好。我只是不明白我怎么可能患有糖尿病。我从不吃甜饲。实际上，我讨厌甜食。
Well, if you don't like sweet food, that will help you manage it. With diabetes, your body can't produce enough insulin to break down the sugars in food, and so sugar remains in your blood.
但是，为什么我一直感到如此虚弱和不适，并感到头晕？
Mainly, because without enough insulin, your body can't break down the sugars in food into a form it can absorb, so your cells aren't getting enough energy from the food you're eating.
有没有治愈方法？
No, not yet. Your diabetes is what's called type 2, and what you have to do for that, is to control the diabetes with medication, and by following a strict healthy diet.
你提到药物，我需要打针吗？
No. If you're careful with your diet and exercise, then you should be able to manage it by taking a tablet, every morning, half an hour before you have anything to eat or drink.
如果我不遵守这一常规会怎样？
Well, if you don't manage your diabetes properly, it'll get worse, and you might have to start having injections. If that happens, you'll need injections every day for the rest of your life.
如果可以的话，我真的很想避免。
And as well as that, diabetics have a greater risk of heart disease, blindness, impotence, and other problems. So, it's a good idea to look after yourself properly.
我该怎么办？应该避免什么？
You need to eat what we call complex carbohydrates. These foods release sugar into your blood slowly and don't raise your blood sugar too high.
我不吃含糖食物，我不喜欢甜食。
When I say sugar, I'm using the word in a general way. It means carbohydrates, not the sugar that people put in coffee or tea. Some foods with sugars in them don't taste sweet at all. These are what we call the complex carbohydrates, and they're the foods which are best for you. Things like pasta, cereals, rice, potatoes.
那芯片呢？我喜欢油炸食品，我几乎每天都有。
Maybe just have chips once a week. You have to try and avoid food that's high in fat, especially saturated fat. So, if you're a meat eater, avoid fatty meat. Use vegetable oil when you fry food. Olive oil is particularly good. And stir frying's the best way to fry food, because it uses less oil. Vegetables are all good for you.
那新鲜水果呢？那可能真是太好了。
That's fine, but you have to check whether your blood sugar level is getting too high. Fruit will increase your sugar level, so you have to eat it at a suitable time. And you should avoid very sweet food, like jam.
听起来越来越复杂。我怎么知道我的血糖水平是多少？
That's easy. You can check it with a monitor you can carry around with you. It only takes a minute or two. The receptionist will show you how to do it, and she'll give you some food information brochures. You can take them home with you and read them at home.
谢谢。最后一个问题，我需要放弃游泳和网球吗？
No, in fact they'll keep you fit. And if your diabetes is properly managed, you'll notice that you don't feel weak or sick anymore, and you'll be able to enjoy them. Just make sure you've had enough to eat, before you swim or play tennis, because hard exercise makes your blood sugar drop quickly.
好吧，很高兴知道。我不必过多改变饮食习惯，只需要放弃薯条即可。
That's right. See how it goes, and come back in a month or so. If everything's settled down and there's no problems, I'll write a letter for you to take to the Road Traffic Authority regarding your driving license, so you can drive again.
那很棒，谢谢医生，下个月见。
End of dialogue. Subscribe to NAATI for All YouTube channel, and click the bell icon to get notified when we post our videos.